Hi, I'm Trey Jurgens, a full-time fiduciary and advisor here in the Louisville office. And today I'm here to talk about one of the most confusing and not everyone's favorite part of the retirement puzzle is Medicare. So to understand how Medicare plays into Social Security, your full retirement plan, when you retire, when you turn 65, I've set up kind of a timeline, and I'm going to go over some of the key terms and features just to kind of explain how exactly we can assist you in planning for that. So going into this, I will get to all these scenarios. Of course, the timeline of when you turn 65 and when Social Security starts does kind of have its own unique features of how that plays into Medicare planning. So I'm going to talk about if you're turning 65 and still working, retired and starting Social Security at 65, and retired but not quite yet starting Social Security. So before we get into all of these scenarios, I want to talk about each individual component of the Medicare puzzle. So original Medicare is exactly that. It's the original plan put in place by the government. You will know of that as Part A and Part B. So Medicare, in its essence, it's a government health insurance program. Anyone that turns 65, but also certain folks that have been on Social Security disability for 2+ years, things of that sort, will be able to apply for Medicare Part A and B. So with that, Part A is known as your hospital insurance. This happens automatically when you turn age 65. So with Medicare Part A, that's your hospital insurance. Medicare Part A covers most inpatient hospital care, skilled nursing, hospice care, and some home health care. Most people won't have a premium for this, and it'll start automatically when you turn age 65. There's some unique scenarios where you may pay for some care, but typically there is zero cost for Medicare Part A. Medicare Part B is your medical insurance. We talk about it, your specialist, you're going to the doctor's office. That is what Medicare Part B will cover. There is a premium, and that's dependent on your income for the 2 years prior to starting a Medicare Part B. Again, another kind of unique feature that is very specific to your situation. However, most people will pay the minimum, which is about $165 monthly. And when you start Social Security, that will be deducted straight out of your Social Security payments. So it won't be out of pocket. It'll come right out of the Social Security payments. So in addition to that, you will have to have a supplement plan outside of original Medicare. That Medicare Supplement, they may call them Medigap plans. They are offered by private insurance companies. You may have heard some folks having Plan F, which has since gone away. Plan G, this is where all those other letters start coming into play. But a Medigap plan coincides along with your original Medicare. So this covers those gaps in coverage that A and B don't necessarily cover. And then these are standardized. So if you know of that insurance company, or if it's a company you've never heard of and it's a Plan G, that Plan G covers you just the same no matter the company. So with that, you will need to have original Medicare before you could ever apply for this. So the timing of that needs to be lined up so that you have A and B with this to start when you lose your previous employer coverage or whatever coverage you had before that. To go along with your Medigap coverage, you will have to have prescription drug coverage. So that Part D, another letter, but Part D, drug, RX, prescription drug plans, you will need to have this to coincide. It has the drug coverage that you need. A lot of the times it's dependent. A lot of insurance companies pair with the pharmacies that you might have your prescriptions through to make it more affordable for you. Again, a very specific thing to your situation. We can help you navigate that. And then finally, you'll see different late night infomercials and things where they're talking about very low or no monthly cost plans, which are Medicare Advantage plans. Part C, which kind of encapsulates A and B and your prescription drug coverage. Medicare Part C, which are the Advantage plans, combine a lot of that coverage, but also put some of the perks in that include drug coverage, vision, dental, fitness programs. It's very enticing with that low premium each month, but the out-of-pocket cost could be much higher. They can do that by putting in networks. Sometimes being in bigger cities, having good network coverage is great, but if you have a doctor you'd like to keep seeing, these networks may not allow you without paying out of pocket to keep seeing those providers. With these plans, they may entice you with that low monthly premium or a Silver Sneakers membership, but at the end of the year, as retirement planning specialists, the out-of-pocket cost could be much higher than having a Medicare Supplement plan with a prescription drug plan. So back to the three examples, turning 65 and how Social Security and Medicare kind of work together along with that magic age of 65. If you are still working, let's start here. If you are still working, you turn age 65, Medicare Part A will happen automatically. You may want to call Social Security or go to ssa.gov and make sure that Part A is the only thing that starts automatically at 65. But if you're covered still by your employer coverage, you will be qualified. You will have good coverage that will not necessitate to start Medicare Part B. So at retirement is that life-changing event that you'll need Part A and Part B, at which point you will need to supplement that coverage with either a Medicare supplement like a Plan G with a prescription drug plan or with one of those Advantage plans. Again, that will be very unique to your situation. If you are retired and starting Social Security at the magic age of 65, you'll have Medicare Part A. Typically, that won't cost you anything. Medicare Part B, you'll be having that deducted directly from your Social Security payments. So at that point, retired Social Security is starting. You will be $165 a month less what your Social Security benefit would be. And then also you'll have to have that Plan G or Medicare Supplement with prescription drug plan. The typical cost, again, this is just run on zip codes near us at 65, male, female, that's going to range anywhere from $100 to $150 a month. And then the prescription drug plans are very minimal. Advantage plans, those are the network coverage. So they may entice you with those low costs, but you're out of pocket at the end of the year. If you have a long hospital stay, could be pretty exorbitant. Finally, if you are retired but not yet starting Social Security, you'll have your Medicare Part A. Medicare Part B is going to be billed directly to you. So you'll receive a bill to pay for that. You can set it up as a direct deposit, all those things that you can do with typical bills. But since you haven't started Social Security, that's where those two kind of fit together. If you don't have Social Security payments, you have to pay for your Medicare Part B coverage. And then same thing, you'll have your Medicare supplement, like a Plan G prescription drug plan, or you can lump it together with one of the Advantage plans. So in terms of understanding how the magical age of 65 works, how Social Security and Medicare all kind of work together, there's really these three scenarios. However, this is one of those things that's very specific to your situation. So if you do have any questions, please feel free to email me at trey@tonywalkerfinancial.com or give us a call here at the number on the screen. It is a very unique situation to how we can help you, but navigating this in retirement planning is one thing we can certainly assist you with. Thanks.